Thank you, Premier. Good morning. So 20 positive cases today. There are now 118 active cases of coronavirus here in Victoria, associated with both hotel quarantine and this cluster. 100 of those cases are associated with the two chains of transmission we're working on at the moment. There is one case currently in hospital and they are not in ICU. And of course we extend our best wishes to everybody recovering from coronavirus here in Victoria. We have around 13,800 primary close contacts in total. That's an increase of 1,700 from yesterday, associated with the ongoing detective work around a number of new sites of exposure. 291 exposure sites now on our system, active exposure sites. We did take off 1,000 primary close contacts yesterday as we continue to exit people from their quarantine through that structured system of day 13 testing and then the release process. With the 41,000 or so test results received yesterday, that now takes us to 250,000 tests over the last week, the first week of this outbreak. Those tests coming back 91.6% of the time within 24 hours. Can I just thank everybody who's come out to get tested? We are seeing an uptick in the last few days, which is very encouraging. 250,000 tests over the last week is a good start. We need to continue that trend as we work on a number of active fronts of this outbreak. Similarly, over the last week, we have vaccinated 236,651 Victorians through both the GP system and the state clinics. It's, as the Premier said, good to see people coming back to really come forward and get vaccinated. More AstraZeneca slots are opening up. There are still some Pfizer slots available in our systems, and we continue to make more slots available whenever we get more vaccines. So please continue to check. Getting ourselves vaccinated is the way we get through these outbreaks. In terms of the 20 new cases overnight, one of those is a student at Al Taqwa College and 5 are household members of other students at the same college. That takes us to 6. All of those were safely in isolation. We have 5 household contacts from students at Mount Alexander College. Again, all were in isolation. That takes us to 11 for the day. We have 4 cases associated with the Caroline Springs Shopping Centre, and I'll come back and talk more about that in a moment. 2 of those associated with the Jolly Miller Cafe, 1 with the YPA Estate Agency, and 1 with Edwards Sourdough Bakery. Some of those cases were in isolation, 2 of those cases were in isolation, the others were still active in the community. We then have 5 new cases that are not currently linked, although we have got some good information to work on, and we're confident we will link them in the coming day or 2. 3 of those are a family from Melton, from the city of Melton, 2 parents and a child. The child was already in isolation as a contact of another primary close contact, but we do not currently have a direct link. However, I'll come back and talk a bit more about a number of exposure sites in the Melton area. And then finally, we have 2 cases, a father and a son, in the city of Melbourne. The son is a student, a grade 1 student at St Michael's Primary School. He was not at school whilst infectious, but out of an abundance of caution, we are, of course, going to test all of his classmates as Tier 1 exposures and the rest of the school as a Tier 2 exposure. His father is a healthcare worker who last worked at the Melbourne Children's Eye Clinic at the RCH last Monday, so a few days ago. We are, of course, contacting all patients and staff associated with that exposure site at the moment. It will be listed shortly. We will also be listing, as a Tier 2 exposure site, the Royal Victorian Eye and Ear Hospital, a small section of it. Again, some very limited exposure, we think, before the infectious period. But again, we are taking a very cautious approach with this Delta strain, as you would expect. We also, with these 2 new people, the father and the son, we have a couple of apartment buildings that we contacted people on last night. We will be regarding those as Tier 2 exposure sites, some Tier 1 exposure sites. They'll be getting tested today. A lot of activity for us there over the next day or 2. So if I look back over the last week, we started very firmly with a number of schools, 10 schools in this particular outbreak. We have now tested over 8,000 direct primary close contacts associated with the various schools in this outbreak out of less than 9,000 primary close contacts. Fantastic support from all those school leaderships and for the schools community in coming getting out, and the majority of those need to continue to isolate for the full 14 days, and my thanks to the whole school community for supporting us in that. We have also had a number of conversations with the leadership group at Bacchus Marsh Grammar, and particularly the Madingley campus. We have asked, under the Chief Health Officer's direction, that Bacchus Marsh Grammar Madingley campus be closed today, and the school's leadership has agreed to doing this. And my thanks to them for their prompt and swift action. Bacchus Marsh Grammar, of course, was already involved in our outbreaks a few weeks ago, did a fantastic job in running those to ground. We know it's very challenging for the school community to see another closure of that campus, but given the high number of students that come in from the western suburbs, we've taken the precautionary step to ensure that those students continue with their online education, and my thanks to the whole school at Bacchus Marsh for supporting us in that. We have active transmission sites that we're really focusing on. We're confident that with Altacroc College and Mount Alexander College, although we've seen positive cases, we're confident we've got a very strong response in place, and those people are isolating well and delivering fantastically good testing results. We have over 90% of returns at the Newport Footy Club and at the Wolf Cafe, and again, those leads, although we'll continue to isolate, we're not seeing any more cases coming out of there. Our focus, therefore, now really moves to Caroline Springs Square Shopping Centre, where we've seen 29 positive cases already. We have declared as a Tier 1 site between the 2nd and 5th of August all the staff who work at the Caroline Springs Shopping Centre. A number of meetings yesterday with the council and with the shopping centre management. My thanks to all the operator, retailers, the employers in that particular shopping centre. It is, of course, a very challenging time. But as we saw with Craigieburn Shopping Centre a few months ago, we really need to get to the bottom of any transmission we're seeing in and around that particular centre. We had a very good testing day yesterday, over 1,200 tests undertaken on site, a number of other tests in the wider area. We will continue that testing drive over the coming days. The second priority location for us is Melton, particularly the City of Melton, High Street of Melton and the retail areas in Melton. We now have 13 active cases in the City of Melton area. 6 of those are new cases today. We are doing a lot of work around Melton High Street, a number of retail sites. There are 13 exposure sites already listed. I expect to see more during the course of today. My call out to everybody who lives in the City of Melton or is using Melton as part of their retailing activity, please come forward and get tested if you have any symptoms or you've been to any of those exposure sites. Can I please remind people, particularly in the City of Melton and Caroline Springs, we continue to be under a metropolitan lockdown. It's important people only go out for those essential purposes and are not doing any other activity in the area. We continue to work at the Flemington Towers. Again, we're seeing a fantastic support there from the local community. I can confirm there are no positive cases in those buildings to our knowledge at this time. We have extensive testing going on throughout a number of those towers, and the levels on which people were, a number of those levels are getting daily surveillance testing every couple of days, as well as additional controls in place. We're working also at a couple of apartment buildings in the CBD where we have new cases living, and they will also get a combination of Tier 1 testing and Tier 2 testing, as well, of course, as St Michael's Primary that I've already referred to. 5 of the cases today are cases we were not aware of before they came through yesterday. We became aware of those cases because the people did the right thing. They got symptoms, they got tested. We have still wastewater detects in places such as Broadmeadows, Glenroy and Jacana around the northern and western suburbs. If you're living in those suburbs and you have any symptoms whatsoever, we need you to get tested immediately. We also have some wastewater detects in the southeast, in Keysborough. Again, the same applies. No matter where you live in Melbourne, in fact, no matter where you live in Victoria, if you've got symptoms, it's critical you get tested early so we can identify whether there are any other chains of transmission going on in this outbreak. Finally, over 1,000 people visited yesterday as part of our home visit programme. Again, very high levels of compliance, I think 99% levels of compliance. We also met 10 flights coming in from those red zones. I'll now hand over to the Chief Health Officer for his update. Brett.